with Iran, costing billions. Inaction on the problems in America, also costing so much to so many. Why? Because the problems are getting deeper and they're draining more people's resources and their possibilities and their dreams. Fix America First has to become our coming together, our collective passion, okay? And we have to focus on the healthcare system as often as we could. The United States spends roughly, and you've heard this probably, but just to remind you, about twice as much on healthcare as most other wealthy nations. Why? The corporate side, the layers, and the culture of them not getting checked on what they spend unless it's about Medicare, okay? And that number's gonna go up. Why? Because they keep making more money. So I wanna give it to you two ways. One is a doctor who I've gotten to know through my work here, who I have a lot of respect for, because Dr. Jaime Seeman sees it in her practice as an OBGYN, okay? She's not a pundit, okay? She's a practitioner, all right? And I wanted to bring in Katherine Hempstead. Why? Because problem, but also what can be done about it. Her new book, Uncovered, great, very clever, The Story of Insurance in America, looks at how we got here and what needs to happen. See? So they work together. First of all, Doc, I know you're very busy. Thank you very much for joining me to talk about this. Again, I came to you recently, and Katherine, it's nice to have you on. You're going to like hearing from the doc. I check with you every once in a while and say, what are you seeing? What are you seeing? What do you want people to know about what's going on right now?
Well, you highlighted that cost is a huge issue, but the biggest pain point as a physician that sees patients every single day is the insurance complexity. I think every time you and I talk, the insurance companies are just creating so much burnout for me as a physician and for my colleagues. The level of prior authorizations we have to do, the peer-to-peer we have to do, coming back and denying payment. I'm a private practice physician, so getting paid for the work I do matters to me and all of the employees that I employ, in my private practice. But what we've gone away from is, we've created these rules. Doctors can't own hospitals. We can't own the system. And physicians are going to huge corporate, hospitals, and insurance companies reimburse them better. And it's forcing doctors into being data entry clerks. Instead of healing patients with my heart and my hands, it's a pen and a keyboard now. And it's getting really exhausting because we don't even know the true cost. When I see a patient, Chris, I don't know what the labs are going to cost. I don't know what the MRI is going to cost. I just treat the patient. But the truth of it is, as somebody who accesses healthcare myself, is premiums are on the rise. Insurance companies are still making record profits, and they have to keep increasing the premiums because of the cost of the care that I give every single day.
Now the other part I want Katherine to hear before we go to her on why this is, you don't believe that this is the process as it has to be. You believe it's by design, Doc. You believe that there is an intentionality on the part of the corporate side to make it hard for you.
Well, I have always believed that it's prevention over treatment, and our system is treatment over prevention. And, the way that insurance companies can vertically integrate their profits, they're owning hospitals, they're owning clinics, they're owning pharmacies, they own every step of the way. That means that they have the ultimate power and control. And they've done everything they can to not let physicians have that type of control, but insurance companies are allowed to have it. And we're their minions.
So Katherine, you know this. And what does it speak to in terms of how we got here? And then I want to hear from you where we can go. But how did we get to this place?
Sure. I mean, I agree with so many of the points that were just made. The relationship with people and their insurance companies is inherently a very fraught relationship. People, even at the best of times, are inclined to distrust their insurance company and think that they're making decisions sort of based on their own interests rather than patient interests. And I think that that's true across all lines of business and throughout time. I think it's amplified lately, especially in health. Health is really that relationship on steroids because it's not just about money. It's really about people's lives. And people want to get access to a screening, a treatment, a drug that they think they really need in real time to be healthy. And there's this intermediary between them and their provider telling them that they can't have it. So that's a big problem.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.